Welcome everybody. My name is Joe Campolone. As you have already read through your emails, I'm the program director for a new neurology residency program at Inspira Health. Today, I hope to provide you all the information that you need to know to determine if Inspira is a good fit for you to train and for you to get information about the area, the hospital, the program, as well as the application process. So today, in addition to myself, I have Amy Land here, who is our program administrator. Many of you have been corresponding with her as well. And currently on the line is also Dr. Tudor Joven, who is the chief and chair of Department of Neurology at Cooper, uh,
Hello,
and uh,
everybody.
and head of the Cooper Neurologic Institute. Dr. Mike Juria is our designated institutional official for Inspira. He'll be talking to you a little bit about GME and future plans for GME. And then lastly, but not least, Dr. Andre Gabriel, who is the program director for the internal medicine residency. His role obviously is important as your first PGY 1 year will be entirely under his jurisdiction. So hopefully you'll get all the information you need to know about that. As pertinent to you, the Inspira Healthcare Network consists of several hospitals, but the residency program will be based out of the Mullica Hill campus. Your next, main campus for clinical hospital work will be at the Vineland campus. There are three other campuses. There are no plans to have you rotate there at this time. And then lastly, the Deptford office is one of our outpatient facilities where the majority of your outpatient experience will be. You will have your resident continuity clinic as well as your subspecialty experiences there as well. Amy, can you just advise me if Mike jumps on?
Sure.
I'm
So,
here.
Yes, he's there.
oh, terrific. Good. First off, I want you to be assured that GME at Inspira is very strong. We have a track record of many GME programs at both the Mullica Hill and the Vineland campus. On the Mullica Hill campus, of course, the most important addition is the neurology residency, which brings you all here today. Both campuses have an ICU. They have a geriatric and separate pediatric emergency department, cardiac lab, cancer center and maternity. As you can see, both hospitals are very busy, and specifically with regards to neurology, you can see that there's ample patient exposure for you to get a great experience. With that said, I want to introduce Dr. Mike Juria, who can talk to you a little bit more about GME, as well as the expansion project that's going on that will affect you with regards to, call rooms and, office space and stuff like that.
Hello,
We need to get
hopefully everyone can hear
on
me.
the next one. Actually, I'm not here.
Can you hear me?
Yes.
Okay, wonderful. So, hello, I am Dr. Michael Juria. I'm the Vice President of Academic Affairs for Inspira Health, as well as the designated institutional official. Um, At Inspira Health, we currently are approved for 18 different residency programs. In addition to what's on Dr. Campolone's slide, we have a critical care fellowship, and we have a brand new cardiology fellowship that was just approved, along with the neurology program. And I think we got everything. So there's 18 programs across the network. Dr. Campolone is correct regarding your primary rotation sites will be Inspira Mullica Hill. And what else was I going to say? I forgot. We have multiple campuses, as explained on the slide, and multiple residency programs, and each program has its own different rotation sites. So, for example, general surgery will cover Vineland, Elmer, and Mullica Hill, as well as the orthopedic program, whereas the OBGYN program is primarily based out of the Vineland campus. For various reasons, which I don't really want to go into, we have duplication of programs. That's for GME funding. And that's a whole like 3-4 hour lecture as far as how GME funding works. You don't have to worry about that. So you just worry that you're in a neurology program and it's a great program. With regards to the Mullica Hill expansion project, the Mullica Hill Hospital is building, and you can see in the photo, building a new 5-story tower. GME will occupy most of the first floor with GME administrative offices, on-call rooms, resident lounge, lecture facilities, and simulation lab, as well as patient exam rooms, which will be used for simulation and teaching. Any questions so far? Okay. Dr. Campolone, did you want me to go over benefits or anything like that?
Not at this time, but we'll have a Q&A session later. And we did direct, I think, everybody to the benefits page on the GME website.
Okay. And I'll be here if anyone has any questions or anything comes up. I'm just going to mute my microphone.
Well, thank you so much. So next, I want to introduce Dr. Tudor Joven. Again, he is the director of the Cooper Neurologic Institute. I was hoping he could explain a little bit about the future relationship between Cooper and Inspira, as well as plans for our faculty and other services down the road. Welcome, Dr. Joven.
Yeah, thank you, Joe, and welcome to all of you. It's very exciting to see that this program actually was approved and will start. You may wonder, as the Cooper guy, so to speak, chair of neurology at Cooper, what am I doing here? And the answer is actually very simple. Cooper and Inspira Neurology are the same. So last year, we formalized a joint venture agreement between Cooper and Inspira. Basically, we formalized this agreement into into everything neuroscience being a unit between Inspira and Cooper. What that means is that de facto, the Inspira did not have that many neurologists, a year ago. Now it has, and it's growing very fast. And what that means de facto is that the faculty are common for both Inspira and Cooper. So even though you will be practicing or your training will occur in hospital in inpatient training, which becomes less and less of a component in neurology, it's going to be at Inspira campus or Inspira hospitals. All the outpatient training will be just the same as the Cooper neurology residents at facilities that are staffed by the same attendings. And that means that basically all the benefits that being part of an academic neurology program that is associated with a Cooper neurology residency, meaning specialized care, fellowships, access to subspecialty attendings, all that stuff, all that applies to Inspira too. I would say the only difference is where the inpatient rotations take place. And the Inspira residents will also have access to all the other access to the research projects that exist at Cooper that we involve our neurology residents, access to teaching of Cooper medical students because they also rotate at the Inspira hospitals. So pretty much, I would consider this very similar to the Cooper residency, with the only difference that the inpatient rotations will happen mainly on the Inspira campus. If there are any rotations, such as, for instance, neuro ICU, or where there is no dedicated unit as such at Inspira, electives can be done at Cooper. But otherwise, in terms of the faculty are the same for both Cooper and Inspira. As Dr. Jeria alluded to, there's and showed you the pictures of the beautiful building that's being built now. A big part of that is also for neurosciences. There's plans for a neuro ICU. There's plans for neuroangiography, even two, if the business will justify it. Neuroangiography suites we already have started. Again, when I say we, I mean the Cooper physicians, but we are one unit. So my group, I'm a neurointerventionalist. My group has already started doing cases at Inspira, in neurointerventional cases using the angio suite there. But the plan is to have a dedicated neuroangiography unit. There are plans to make Malika Hill a comprehensive stroke center. The level of care will be equivalent, and sort of that's the plan. That's kind of the overview, and it may be a bit confusing, Inspira versus Cooper. And yes, there are two separate residencies, but de facto, in terms of who's going to teach you, that's going to be the same faculty that will teach the Cooper neurology residents. On the inpatient side, we have neurohospitalists at Inspira. They're dedicated there. They're dedicated to Inspira only, and your inpatient rotations will be under their supervision. They're very good. That's what they do, just neuro hospital medicine. We have a stroke presence as well. We do telestroke consultations at Inspira, and we would very much welcome your guys' involvement in these interactions as well. So you will have exposure to the whole gamut of neurological conditions. As I said, in terms of outpatient facilities, our neurologists at Deptford, we have representation from all subspecialties. So you will not have any kind of you're not going to miss any kind of exposure to subspecialties. And if there is some subspecialty that's not represented, the Cooper campus will be totally accessible, just for our Cooper neurology residents. I just want to say a few things. I think, first of all, congratulations for deciding to going into neurology. I think it's incredibly exciting times. Probably the best specialty to be in right now. I can tell you, as a chair, maybe my main job is to recruit people, and it's not easy. Neurologists are in very high demand nowadays, and that demand is growing exponentially. So you will not have any problems finding a job. In fact, most of our residents now move on to complete fellowships after they finish. It's a field that's exploding. As you well know, probably that's why you decided to go into neurology nowadays. we can actually do something about all these fascinating diseases. It's not only the diagnosis and the mental exercise of caring and diagnosing these patients, but nowadays, pretty much for every disorder we have treatments, and that's what makes neurologists now so sought after. Um, we are also very mindful of the fact that AI is going to have an increasingly prominent role in the way we manage patients and diagnose, and we are sort of orienting teaching also towards the parts that are AI proof, so to speak, the humanistic part of medicine and neurology. That's very important for us. And I think these are going to be the skills that will prevail and will make us better physicians in conjunction with AI. And that's something that we place a lot of emphasis here on. I mentioned research and research opportunities. We don't consider research to be essential for the education as neurologists. For the ones, though, who are interested, who have that calling, we offer great faculty mentorship projects. I'm actually here at the International Stroke Conference, and we have 6 posters that are all done and presented by medical students or residents. So we are very active in research, but as I said, I don't see it as mandatory. What we see as mandatory is making sure we educate our medical students. There will be medical students rotating, and part of your job will be to educate them and teach them. So, I think what differentiates the Cooper Inspira Neuroscience and the residencies are they're small enough, they're not anonymous compared to other places, and the faculty that come here are just totally focused. They come to Cooper and Inspira. They join us because they're dedicated to teaching, and that's very palpable in terms of the satisfaction of our Cooper residents. And as I said, the faculty are going to be the same, so I don't see any reason why the experience for the Inspira residents will be any different. Finally, Dr. Campolone has been the founder of the Cooper Neurology Residency. He has led and grown the program significantly over what was it, Joe? 15 years?
16.
16. And you won't have a better advocate and residency program director. I'm very glad he agreed to take on the Inspira job. And you won't have a better residency program director than Joe. He's going to make sure that your educational experience is top notch. So thank you for taking a look at our program, and I'm going to give it back to Joe now.
Thank you so much for all that information. You actually covered a lot of stuff that I was going to discuss. First off, yes, you have 24/7 coverage by an attending for both of the campuses, so you will always have someone accessible should you need to call someone or need supervision or whatever, have a question. And that's their only responsibility. So they have sole dedication to patient care during their week on. And then, as Dr. Jovan also mentioned, our outpatient cohort of faculty is continuing to expand. I don't want to dwell on this too much, but we have general neurology. Dr. Constantinescu is your outpatient supervisor, is a neuroimmunologist, and is also leading our Alzheimer's treatment program. Dr. Corin is a former CMSRU student who is a vascular specialist. Myself, I do EMGs and neuromuscular. Dr. Sharkus, a former graduate of our Cooper residency program, is rejoining as a neuroimmunologist. Dr. Deveni's movement disorders. Dr. Lewis is also neuromuscular and headache, and Dr. Wilford does sleep studies and movement. So this is all in place at the Deptford facility. So you already have a opportunity to see all the different subspecialties. As Dr. Joven mentioned, not here we are. Not all of the subspecialties are yet represented. For example, neuro-ophthalmology. So obviously your neuro-ophthalmology experience would occur at the Cooper outpatient facility. So just for a reference, the blue circles here are the Inspira sites, and the red spots here indicate the Cooper sites. So you can see they're in proximity to one another. Again, when you are on the hospital service, you're not going to have clinic, you're not going to have outpatient duties, so you're not driving back and forth, in the same day. You're usually assigned just at one place, and you'll be staying there. So there'll be minimal transportation. So, so this is a brand new program, and so why, should you have confidence in this? So first of all, I think this is a great opportunity for residents to get in on the ground floor of a brand new program, because you can help mold the future of the program and help set a precedent to help continue to build and grow the program. So as Dr. Joven mentioned, I was the PD for 16 years at Cooper, and I was in the same situation I'm in now. I had a residency program, but we didn't have residents yet. We were approved, and I became PD in 2008. Our first residents didn't join until July of 2009. So exactly the same circumstance I find myself in now. This bottom picture here, in fact, is our first class that graduated in 2012. I have, a real dedication to teaching and education. I work very closely with the medical school. I have been the clerkship director at UMDNJ prior to the development of CMSRU, and I retained the clerkship director role there for several years as well. I have won, several teaching awards, but I've also, very interactive with the residents. As program director, I'll be holding, basically a monthly meeting with you just to get a feel, lay of the land, how everything is doing. I run several conferences and participate in several other conferences. So you're gonna, I'll be around. You'll be working with me. You'll be doing EMGs. You'll be learning skin biopsies from me. These are the things that really make my day. And so in addition to, the quote unquote Inspira faculty, there are Cooper faculty who also will be integral to your training. And here again, just a few of the others. Dr. Olga Tone and Judy Deep are also neuroimmunologists. Olga is also the PD at Cooper, and I work very closely with her because as you see, you will see there are several things where the programs will collaborate for the mutual benefit of both programs. Dr. Calife is one of our neurointerventionalists. Dr. Tone is also one of our neurovascular specialists. Dr. Hanafi is the CNI Director of Research. And again, as Dr. Joven mentioned, you'll have great opportunity to participate in research. This program is oriented to clinical neurology, but you'll have ample opportunity, obviously, to participate. And likewise, as the one slide indicated, Dr. Joven oversees the CNI, which includes physiatry at Cooper, PM&R, as well as neurosurgery. And neurosurgery at Inspira is also covered by our Cooper CNI physicians. Dr. Godel and Madhavan are pictured here, so you'll be working with them as well on many patients. So you can see that the hospitals are busy. Likewise, the outpatient office is very busy as well. These blue dots just represent the Inspira outpatient facilities that will be serving. These are primary care facilities and some other subspecialties. these are the people that will be sending you patients for neurologic consult in your resident clinic or in the subspecialty clinics. So this is a very robust source of continuous patients, not only diverse in their socioeconomic demographics, but diverse in their acuity as well as their underlying conditions. So you're going to see everything. You're going to see tons of the bread and butter neurology. That's really what it's all about. You're going to see tons of migraine, tons of carpal tunnel, back pain, things like that. That's, what outpatient neurology sees. But you're also going to be intellectually stimulated by a lot of the interesting, cases that, come into you as the first neurologist to see them. And I can tell you from the resident clinic at Cooper, we see all sorts of stuff that, inclusion body myositis, myasthenia, ALS, obviously some encephalitides and things. Very interesting cases that you will be the first to see. So I want you to be assured that, the subject matter, our patients, will be, very helpful for your education. So your child neurology rotation is a requirement of the Board of Neurology as well as ACGME. You will spend 3 months at Nemours. I can tell you that this is a very strong clinical exposure than some other programs might offer. Nemours is a top-notch, purely child neurology experience. We have a program letter of agreement with them. You will not start your pediatric neurology until your PGY3 year. So just keep that on the horizon that is coming down the road. And again, just to put Nemours in perspective, it's right across the river in Wilmington, so it's fairly close. And again, you're not going to have other duties. You're not going to be driving back and forth between campuses. You will be assigned to either Nemours or one of the other sites. You're not going to have to drive, to multiple locations any day. So right here, this is going to be 99% of your clinical work will be at these locations. So you can see nothing is really too far, but you can see that you will need a car or some other form of transport to get between the campuses. Again, when you're assigned at a place, you don't have to go anywhere else, but for your different rotations, there will be a need for a vehicle. So the curriculum. So your neurology curriculum consists of required rotation. These are all, again, mandated by ACGME. Not only do we meet the minimum requirements, but we exceed them in all circumstances. And we'll get into this in a little bit more detail with the block schedule. And then these are all the electives that are available. And as you can see, there's really pretty much a broad gamut, and almost all the neurologic subspecialties are represented here. And again, these are clinical neurology rotations that you will have access to during your elective time. So this is what a block will look like. So you can see, obviously, the PGY 1 year is all predominantly internal medicine. That will be under Dr. Gabriel, who you will hear from shortly. We have a 2-week rotation in pain and palliative care. I think that's important for you to get that exposure as a PGY1, because obviously in neurologic clinics, you're going to be dealing with patients who are going to have end of life issues, chronic pain, etc. That this experience will be helpful. And then your 1 month of required psychiatry also occurs during your PGY1 year. As PGY2s, you will have 3 months on general neurology at Mullica Hill. That's these first 3 green blocks. You will have 1 month of general neurology at Cooper. And then compared to a lot of other programs, you can see the rest of your PGY2 year is all outpatient neurology. So all of your continuity clinics, as you can see here, they span the academic year for PGY2 through 4. But all of your clinics will occur during your outpatient rotations. And again, this is to help you, focus on patient care so that, if you're rounding in the hospital, you don't have to leave at noon to get to clinic. So you'll be protected in that regard. As a PGY3, you will be the sole resident covering the Vineland neurology consult service for 3 months. And then you will have 2 months at Cooper, one in the neuro ICU and one doing stroke at Cooper. And then because the workflow of stroke at Cooper is a little different than it currently is at Inspira, although that will change down the road. And then you start your foray into child neurology with 1 month during PGY3. And then your final 2 months of peds neurology as a PGY4. Take note, all the other remaining time is elective time for PGY3, in addition to 7 months of elective time as a PGY4. Likewise, PGY4 does have 3 more months of inpatient experience functioning as the senior resident on the Mullica Hill service. So the Mullica Hill service will generally have, ultimately, when we have all resident spots filled, there will be a senior resident PGY4 and a PGY2 resident on the service at all times. And Vineland will have a PGY3 resident, namely because Vineland is purely consultative in nature. So again, some of the benefits of this block schedule are that you get ample outpatient exposure. This helps you decide what your career, your subspecialty you're interested in, because you get to see everything. Other programs, the first PGY2 year is all inpatient, and you don't get exposure to movement disorders and neuromuscular or headache. So I think this is another advantage. So the Mullica Hill will have a consult and a neurology service. There will be, as I mentioned, a dedicated attending at both campuses 24/7. You'll have, this is a mistake, but it's a PGY2 and a PGY4 neurology resident. You'll have rotating residents from psychiatry. They have required neurology exposure, as well as our internal medicine, transitional year, and other rotators. And then we have medical students. So the medical students from CMSRU rotate at both Mullica Hill in Vineland. And then likewise, we get M4 students who are doing their audition rotations at either campus as well. And so you'll be involved in providing education to them. Continuity clinic is a requirement of ACGME as well. Again, this occurs during your PGY2 through 4 years. So clinic is a great experience because, again, there's a dedicated attending. They are assigned that session. They have no other clinical duties during that block. So they are, at your disposal. There is a maximum of 3 residents, so the ratio will never be greater than 3 to 1, 3 residents to 1 attending. So you won't have a lot of competition to present your cases, and you'll have ample time for the attending to give you the teaching that you deserve. And then residents are also limited to how many patients they see. Obviously, that's staggered. So PGY2 residents will see less patients because obviously it's going to take you longer to see a patient, to write your note, to think about it, etc. But as PGY4 residents, that number increases because we want you to be prepared for the real world. The real world is that you have a busy schedule, and so we will gradually increase the schedule burden for you so that you can be successful beyond the walls of the residency. Call schedule. So this is not what the call schedule is going to look like 5 years down the road, but this is an opportunity for you to take advantage of our, being the new kid on the block, so to speak. Because we don't have a full quorum of residents, we won't have enough residents to adhere to duty hours, so the call schedule will be phased in over several years. This is your benefit as someone who will be in the first class of this program, because your call schedule is actually going to be pretty decent. As PGY2s, we will only have 4 residents, so there will be no overnight call. You will have short call till 9 p.m. during weeknights. Again, currently, the faculty are covering this all by themselves now. So even, the short call will be a benefit to them. And then you also gain some experience about being on call. And then the subsequent year, we will have PGY2 and 3 residents who can participate in call. And so we'll have overnight call distributed as you see here. So the PGY2s will have 70% of the coverage, and PGY3s, which would be you, will have 30% of the coverage. And then likewise, as PGY4s, you get even less call. So for you people all here, interested in joining us this July, this is another advantage, in addition to all the others, of getting in on the ground floor, because this call schedule is not going to last. This is just a temporary placeholder until we can get up and running. And then, the idea will be that we would have 24/7 resident coverage on call. But again, you have opportunity to get in at an ideal point with a much nicer call schedule. So we have Hello? So we have multiple multidisciplinary conferences. Almost all of these will be in collaboration with the residency at Cooper. I run the EMG conference monthly. We have an epilepsy surgery conference, neuropsych, so a neurology resident alternates with a psychiatry resident and presents a case every month. Faculty from psychiatry and neurology, as well as our neuropsychologists, participate in this. There's multiple stroke conferences, and the stroke board also serves as your M&M conference. So this is where cases are discussed about how to improve the workflow, how to improve outcomes, etc. And so this provides that aspect of your required education. Multidisciplinary spine is with ortho, neurosurgery, neuroradiology, and then, of course, brain tumor includes neuropathology, neuroradiology, neurosurgery, neurology, and our physicists who plan the gamma knife. So the left picture here is an illustration of your monthly didactic schedule. The things listed or highlighted here in yellow are the recurring events. So every month, again, the first Monday is the spine conference. The third Monday is board review. The fourth Monday is neurovascular conference. So these are all in place. So every month you're going to have those. And then the ones in red are the multidisciplinary conferences, so neuropsych, EMG, etc. And then all the others are going to be different subspecialty conferences. And just an example of the didactic schedule is shown on the right. So you'll get, obviously specialty-specific didactics from the experts in the field. So, for example, you'll hear from me about muscle biopsy, and you'll hear from Dr. Deep about spinal cord disorders. So your month is going to be full. We strive to make sure you have at least one didactic session every single day. You are protected. So during the hour, you will forward your pages to the attending. That way you can participate in didactics without being interrupted by calls for Tylenol and things like that. This obviously is from my history as a Cooper PD, but the Cooper medical students have a required neurology rotation, and almost every block we have 15 students, of which about 6 or so will rotate with the neurology service at Inspira, either both Mullica Hill and Vineland campuses. So you will almost always have a third-year medical student with you. Learning how to teach is part of what we want you to learn. And we do host an annual teaching award. We haven't figured out exactly how we will roll that out yet to incorporate the Inspira residents. But obviously, anything you teach a student, mentorship, guidance, is greatly appreciated by the students as well as us, the faculty, because you make our life easier. I will mention that all of the medical students are required to have a research project, And many of the residents use this as an opportunity to collaborate with a student because there's a mutual benefit of producing an abstract or a poster, and you get your name on it too, and you can help them with a lot of the clinical stuff, and they look to you for their guidance. And so this is, low-hanging fruit, as they say, a way to get a poster and abstract because you have the medical student do most of the work, and you just do the hand-holding along the way and guide them. So diversity and wellness. So there is Inspira hosts a monthly diversity grand rounds. That's an institutional session that is on that recurring event calendar I showed you. We obviously teach DEI and many of your didactics. We deal with a very broad socioeconomic population. And our goal is to teach you not how to treat just epilepsy, but to treat people living with epilepsy. And, all of these conditions affect people differently. And just as an example, if you have someone who, does not have a home and they have substance use disorder and they have epilepsy, they're going to be managed a lot differently than a CEO who flies an airplane who develops epilepsy. And obviously the disease is the same, but the management is completely different. And so these are the skills that we want you to have, and that is why I think a diverse patient population that you will see at Inspira is so important to you. So we also have a diversity committee, and residents are invited to participate in that. Dr. Lewis, who I showed you on a prior slide, is actually one of our newest attendings to join, and she is the Associate Dean for Diversity and Community Affairs at Cooper, and so she's rolling out lots of projects that will intertwine with our mission of the residency program as well. One of the things that we have had success with, and we plan on collaborating between the programs, is some of these wellness events. One of the biggest successes has been Journal Club. Dr. Joven, in fact, just hosted Journal Club a few nights ago. And this also serves a dual purpose in that it's a wellness event. And many of the journal clubs, we have a concurrent cultural night. So in addition to talking about a scientific article, we share cultural backgrounds. And so people bring a trivia question about their culture. They bring a food dish. Different cultural music is played, and so this, is often done in conjunction with some other wellness event like a journal club. We anticipate collaboration in this regard because obviously diversity and wellness, the more the merrier, the more cultures and people you include, the more rewarding it is. We also anticipate collaborating at our retreat. So the two bottom pictures here are from past retreats. One retreat, we participated in nerve conduction studies. So all the residents got to zap each other and practice how to obtain median and ulnar nerve responses, etc. And then we have some wellness events, fun and games, and things like that. We have lots of parties. We have a welcoming party every year. We have a graduation party every year. We have a winter holiday party every year. Birthdays, or sporadic, parties held whenever the birthday is. So again, lots of opportunities to participate in these events. And likewise, we will nominate a wellness officer. So in addition to a chief resident, a wellness officer will oversee the residents' wellness and help organize wellness events, some with residents only and some to include the faculty. Mentorship. So all residents are assigned a faculty mentor beginning in PGY1. Their role is not to push you into a subspecialty or anything, so we don't match you to a specific, movement disorder or whatever. Their goal is just to make sure that you're doing okay, to give you guidance on how to manage life, and check in on you at least twice a year. You'll have a cup of coffee or a bowl of soup or something with them, and make sure that everything is going well. So research, as Dr. Joven also mentioned, research opportunities abound. We anticipate there'll be lots of opportunities for quality improvement and research, obviously internal to Inspira under the guidance of your faculty, but there are some projects that could mutually benefit both campuses and opportunities, for example, for stroke research. Obviously, lots of opportunity there. Inspira, the institution, also holds an annual resident research day for posters and abstracts. So, again, these opportunities are supported. I would mention, and Dr. Dre can correct me if I'm wrong, but in addition to the stipends that are mentioned on the benefit page, we also offer stipends for research. So, for example, if you're presenting at a national meeting, we will have a stipend available for that because we want to remove any barriers. If you were presenting a poster at a national meeting, that's not only good for you, but it's good for Inspira and all of us and the faculty that are included. So we want to make that happen. And
oh, that is correct. There are some funds available for research activities.
The top picture here is from the American Academy of Neurology. The ABPN requires that all residents attend a national meeting. There are other options, of course, in the various subspecialties, the Neuro ICU meeting, the Movement Disorder Society, Epilepsy Society, etc. But we do support your attendance because, again, it's a requirement for you to be board eligible. So I think at this point, Dr. Gabriel, I would, I guess, invite him to give you a little background on the PGY 1 year.
Hello, guys. I'm going to share my screen. I made a quick PowerPoint for you guys.
And I will stop.
Can you guys see my screen here?
Yes.
Perfect.
Yes.
Okay. So I just want to quickly show you guys what your PGY 1 year will kind of look like. Beautiful shot of the hospital here. Of course, program leadership, myself, I'm the internal medicine program director. I've been in this position now for a little over probably around 2 years. Of course, Dr. Campolone is the neurology program director. A shot of Dr. Juria as our DIO. And because you guys are going to be rotating through internal medicine, you will be dealing with Tammy Dershinsky, which is our program manager for internal medicine. I wanted to give you guys a quick shot of all our residents currently in our program that you guys will be interacting with. And for us, we're currently at 14 residents per year, but for next academic year, we're up to 24 spots. So there's going to be a lot of interns, PGY 1s for next year. So just a little overview of the program. It is a 1-year training program for residents per year. One of the big things that we have night float and admitting rotations. We don't have any 24-hour calls within the program. Our residents like this. We do have educational meal stipends. We have PGY 1 boot camps. Basically, this is a boot camp that you guys will do, the first couple of days during orientation, where it's going to be myself and rest of leadership. They'll teach you guys how to survive your intern year. We're going to teach you things like how to chart review, how to do like a focus history physical exam. We're going to teach you guys how to do a lot of the how to present and how to document your notes. And as per my discussion with Dr. Campolone, there's no continuity clinic time that's really required for the PGY 1 preliminary year. Just an overview of the curriculum. Myself and Dr. Campolone kind of made this up. What we wanted to do during your time on internal medicine was to give you guys a broad range of different specialties within internal medicine. So you're going to have 10 weeks of general medical floors. So just to give you guys something about that. So you'll have one resident and there's going to be 2 interns. The cap is usually around like 18 to 20. Ideally, we like to keep our caps like close to like 18. So it gives you guys enough time to like see your patients and write your notes. ICU, there's 8 weeks. We have a medical admitting rotation, swing rotation, and night float, which I'll go over in the next slide. As what Dr. Campolone said, you guys will be doing a palliative care / pain rotation for 2 weeks. You guys will have 8 weeks of electives. And as you can see here, these are different selective rotations that you guys will be scheduled into. Cardiology, nephrology, hemonc, pulmonary, GI, and you guys will do 4 weeks of psychiatry at Inspira Vineland. All the other rotations will be done at Mullica Hill. Now, of course, this can be subject to change as we continue to look at this, but this is the iteration that I gave Dr. Campolone a few days ago. Now, I just wanted to show on here selective versus elective rotations. Like I said, these selective rotations are going to be these different subspecialties within internal medicine. This should already be built into your schedule. The elective rotation here, this is just an example. To be honest, it's whatever you guys want it to be when it's your time to do an elective rotation. Basically, you guys will meet with myself and Tammy at the beginning of the year, and you'll let us know, what electives you guys are interested in so that we can build that directly into your schedule. So if you guys want to be in neurology, we could throw that onto your schedule. But if there's any other things that you guys are interested in, we can kind of get those electives done for you guys as well. Now, I just wanted to show you briefly what the night float schedule and what the admitting schedule rotation looks like. So on here, you guys will be part of a 2-team night float system. So it's going to be one resident, one intern, right? And there's going to be 2 of them. So when one team is working, the other team is off, right? And night float is a 2-week rotation, not a 4-week rotation. The good thing about this system is that when you're on night float, you will have 5 scheduled days off. So normally on night float, you'll have like one scheduled day off per week. So with this kind of schedule, you'll see on here for, let's say, for night float A, 1, 2, 3, 4, 5 days off, scheduled days off. So this was a recommendation from one of my chief residents, which we made into reality so that we could make sure that residents don't burn out when they're on nights. On here also, you can see there's the medical admitting rotation where you'll be in ER doing admissions, and you'll have a senior resident that's overseeing you. And you also may be part of the swing shift, right, where you work from 3 to 11. Again, you'll have one resident, and there's usually 2 interns that are on the swing shift rotation. And when you're on medical admitting and swing shift, you will have like 1 day off. Now, our educational curriculum. So for internal medicine, we have didactics noontime every day, Monday to Friday. So we have noon conferences, resident report, journal club, faculty-specific IM lectures, and other specialty lectures. Sometimes that will be from palliative care. Sometimes that'll be from neurology, psychiatry, radiology. Just depends on the month. We do have network-wide specific lectures, like what Dr. Campolone said. We have DEI, M&M conferences, grand rounds, tumor board, and we also have something called practicing excellence. So this is a series that's specifically to help physicians increase their communication skills and to work in a team. We also want you guys to rotate through our sim lab. And the big thing here is RRT and code blue scenarios. We want you guys to be comfortable in the code team, because when you are on the medical floors, you will be part of that code team. So we want you guys to get comfortable with being a person in the code team. And we will also have morning reports. I think it's on Tuesdays or Wednesdays from like 7:30 to 8:30. So a few of the benefits. The one thing I wanted to talk to you guys about is that you will have 20 flexible PTO days. Because you guys don't have continuity clinic, you can use your PTO days on your selective and elective rotations. And for this, when I counted it, you guys will have like at least 18 weeks to use your PTO. So I'll give you a scenario. So let's say you're on a cardiology elective. And the good thing about this, when you're on your selective and elective rotations, you're not scheduled to work those weekends, right? So you have a golden weekend. So let's say you wanted a 4-day weekend. So you can ask for PTO on a Friday, you're off the weekend, and you can ask for another PTO on Monday, so you can have like a 4-day weekend. So my residents really like this because it allows them to kind of schedule life around residency and not the other way around. So we're going to be doing the same with you guys. We do have a meal stipend. So the meal stipend was there more for people who do 24-hour calls. We don't have any 24-hour calls within our residency program, but we still have the meal stipend. So it's $100 per month if you guys want to use it for whatever. Here are the holidays that Inspira observes: New Year's, Memorial Day, 4th of July, Labor Day, Thanksgiving, Christmas Day. We do have a swap system. So if you do have a holiday, like Eid or another holiday that you want to swap to, we do kind of help out residents so that you can spend some time with your family for the holidays. You do get 1 lab coat and jacket per year. My residents are jacket people. We did Patagonia jackets last time. So we get that 1 per year. And our library access is through Rowan School of Medicine. And so just a quick thing about wellness events, because you guys will be fully entrenched within the internal medicine program, we do have a wellness committee. Now, the whole big thing about our wellness committee, it is chaired by our PGY2 resident. One of their big things that they do is they kind of monitor burnout for residents. So we do send out anonymous surveys to kind of see, what are the issues that residents are coming up with. And this is how we kind of figured out that night float was burning out our residents. So that's why we kind of made the change to the 2 night float team system. Once we've addressed a lot of the issues, we do have quarterly events planned by the wellness committee. And for any kind of mental health support, Inspira does have Care Bridge or Cure Link. So if you need anything from a mental health standpoint, Inspira is well equipped to handle that. Just a few examples of the wellness events that we have had. Pickleball, top golf, axe throwing. I do host an intern welcome picnic. In the beginning of the year, where I asked the new interns to come in and bring in a dish that best represents their culture, so we can learn more about you. We do have holiday parties, and we, just like Dr. Campbell, we do have Journal Club, which is hosted by an attending. So it's like a combined wellness event and Journal Club. So we did that before a couple years ago, and the residents want it back, so we started doing it again. So just a couple pictures for our wellness events, and that's it. We do have an Instagram. We do have, and if you have any other questions, Tammy's our contact person. So again, or any questions you have about the preliminary year, just let me know.
Thank you so much. So I just have a little bit more, and then we'll have a Q&A session. So I think what you are interested in, of course, is the application process. So we are seeking only PGY1 positions to begin this spring. All applications must go through ERAS. The interviews obviously will only be virtual through invite only. And all positions will be filled hopefully through the match. We are participating in SOAP. We do not require a step 2 score for you to get an interview, but in order for us to rank you, we do need that on file. And obviously, the brevity of time that we have to work, the deadline is coming up very soon. So probably best to get the step 2 score in ASAP. We do require a minimum of 3 letters and preferably one from a neurologist. We only accept ECFMG sponsored J1 visa. We do encourage couples matching. So as you've already seen, there are numerous other residency programs between the 2 Inspira campuses, and likewise Cooper, and then all of the Philadelphia institutions, Jeff, Penn, Einstein, etc., Temple, are nearby as well. So this is actually a very great place to consider, ranking for a couples match because of the nearby opportunities and other specialties that are available. And so just to close, why pick Inspira? So, well, again, that reason I just mentioned, these faculty are here because they like to teach. As you've seen, these are all dedicated academic faculty, all under an academic program. And they all chose to be here because of the teaching opportunities. You're going to see a lot of great stuff. You need to see tons and tons of bread and butter because that's how you get good at it. But you're also going to be challenged with interesting and rare cases that can serve for research purposes as well as to bolster your knowledge. This program, you're going to get lots and lots of outpatient and elective exposure. I think if you compare this to other programs, you'll see this is a favorable opportunity for you. The call schedule, again, getting in on the ground floor, this opportunity doesn't come around too often. And one of the benefits will be that the call schedule will be a little easier than it will be, 5 years down the road. And again, you have all the subspecialty electives represented here at Cooper, here at Inspira, between the movement disorder, neuromuscular, epilepsy, EMGs, EEGs, everything's available. And I think you will have a great educational experience. So with that said, I know I'm going to open this up to Q&A. I want to thank some of you who submitted questions ahead of time. In the chat, I see there's one about continuity clinic. So the board requires that your clinic, you have at least 40 sessions per year, and you cannot go longer than 5 weeks in between having a continuity clinic. So when you're on, the hospital service, you are protected. You won't have to leave the hospital to go to clinic. So that means in the weeks in between, when you're on outpatient or elective, you'll have a couple sessions perhaps in 1 week. So 1 week you might have two, week you might have one. But they're all those 40 sessions are condensed into the time on your outpatient or elective experience. Another question about when will the invites go out? So we just opened up on Monday for Iris. We anticipate invites will start going out later today as well as tomorrow. And like I said, we just started sifting through all the applications because we just went online. Another question about will the didactics be shared? So almost all of the multidisciplinary didactics will be in collaboration with Cooper. And I want to mention that I run the EMG conference. We also do that in collaboration with the Rutgers residency program because they don't have an EMG conference, so they join mine. And so, it's all virtual, so the more the merrier. And then some of the subspecialty didactics will be shared. So, for example, if Dr. Gottlob is giving a lecture on papilledema, as one of the only neuro-ophthalmologists, then yeah, there's, have both programs participate in that session. COMLEX scores, yes, we accept and encourage COMLEX scores as well. It doesn't have to be USMLE. COMLEX will serve the purpose. And then epilepsy monitoring unit. So Inspira currently does not have an inpatient EMU. During your rotation on general neurology at Cooper, you will have opportunity to take care of patients on the EMU. That's part of the general neurology service is the EMU coverage. So can I speak a little bit about the city? So I will defer this to Dr. Gabriel. I can tell you, first off, that I live in Mount Laurel, which is, so Cooper is between Inspira and where I live. I can get to Mullica Hill probably in about 40 minutes or so, maybe 45 from where I am. One of the nearby colleges, Rowan, is a state university. It's only a couple miles away from the Mullica Hill campus. There's lots of activities geared obviously for college students, but there's lots of housing, but there's also lots of entertainment, nightlife, largely centered around the college. But obviously that's available for residents and other people. And I will let Dr. Gabriel take it from there because that's where my knowledge ends.
Yeah, so Mullica Hill is a busy place. Again, I agree with Dr. Campbell that it's close to Glassboro, which is kind of like the college town because Rowan is there. And it's not it's not an inner city. There's a lot of driving around that area, but it's a wonderful place. I think they've been building it up for the last I've been in South Jersey for a very long time, and I've seen them develop Glassboro and Mullica Hill. So it's a wonderful place to be in because there's just a lot of stuff that's going on in the area. And of course, you guys will also be rotating at Cooper. Cooper is more inner city kind of setting, but it is developing. Cooper is a wonderful building, and the city is fairly safe, especially around the hospital area. So being able to practice at both, I could tell you, it's nice to be there. Of course, I prefer Mullica Hill. I'm biased, being in the program director there. But yeah, it's great. I also wanted to address the other one. What's the patient volume like? So Mullica Hill is busy. We are very, very, very busy. We have had, we've been on divert multiple times because the hospital is very busy. I think that's one of the reasons why we're justifying the expansion. And I'll let Dr. Campbell talk about the diversity of cases because he'll probably know more about, especially from the Cooper side. But we do see a lot of diverse cases. Internal medicine wise, you'll see a wide variety from your very simple pneumonia cases to very complex. So It's really cool because you get to see both sides of just like simple versus complexity from an internal medicine standpoint.
Yeah,
Andre, I want to make a comment if I can.
sure.
So regarding COMLEX scores, if you are an osteopathic student, we will consider both COMLEX and USMLE. But if you do not have a USMLE score, we will accept just a COMLEX score. If you did not take the USMLE, just so everyone knows that.
Thank you. So yeah, so I actually also can comment on Camden. So again, you're going to be spending 3 months in Camden. Maybe if you choose electives, maybe more. So I've been at Cooper for 28 years. I've never had a problem. Camden is a city just like any other city. It's no different. There are good sections and there are bad sections. The area around the hospital is surrounded by the medical school, and almost all of the housing there is now filled with medical students, postdocs, professors, and residents. And so it's currently safest now than I've ever seen it. And even when I started, in '96, I walked around, I go to the bank in the center of Camden, for lunch and go get money or whatever. I had no reservations at all. Again, there's parts of Camden, there's parts of Glassboro, there's parts of any town that you don't want to go into, and that's no different than any other city in this country for sure. Another question. Oh, so the transition. So from PGY 1 to 2, yeah, I neglected to mention that we also have a boot camp to orient you more towards the neurological aspects. So you'll have all the basic stuff down, obviously, through your PGY 1, but we'll be focusing more on stroke and spinal cord compression and other neurologic emergencies. We also have a SIM program. So there's SIM for lumbar puncture, but we also have stroke vignettes and other acute neurologic emergencies to go through, obviously to give you the confidence so that when you're on call, that you feel that you are capable of taking care of the patient. So we will certainly give you all that training before you dive into neurology residency at the beginning of the PGY2 year. So there's a question about when will the expansion be completed? So as Dr. Joven mentioned, I don't know the timeline, but we do plan on having a neuro ICU and neuro intervention suite at Inspira down the road. Currently, we have stroke and neuro ICU rotations planned for you at Cooper. But if those things become, materialize prior to that, then obviously the location of those rotations may change. But we do anticipate doing endovascular treatment on site at Mullica Hill. Perhaps Dr. Juria can comment more on the timeline.
The expansion is supposed to be completed by the fall of 2026.
So there's another question about evaluation. So you will be evaluated by your attending at the end of every rotation. It's all collected through New Innovations online system you may be familiar with. The residency has a clinical competency committee, as I'm sure the IM people do. The faculty will discuss each resident's performance semi-annually and then assess residents based on the ACGME milestones and put them into your portfolio. The program director, will meet with you after each of those CCC meetings to review, go over your competencies and where you were placed on each of the scores, and to provide a learning plan for you. How everybody obviously can improve. So we could come up with a plan on maybe to schedule more electives in a certain subspecialty or to go to a certain conference or something like that. So again, that's done semi-annually, and then obviously in the spring, that meeting also makes the assessment for whether to let you proceed into the next year or to graduate. What is the minimum score? So there are no minimum scores. Everything is circumstantial and situational. So we don't run any. I don't run any filters on the applications. I look at each application as a whole because everybody has different things to offer, and so there is no cutoff for a specific score. Uh, so how does the resident support those who want to learn to be educators? So as I mentioned, you're going to sort of be forced into that role. You will have a medical student or two with you, perhaps almost all of your inpatient rotations, and then even in continuity clinic, you're going to have some medical students, working with you, seeing patients. So we're going to rely heavily on you to teach right out of the gate. They again, we will sponsor a teaching award to recognize the efforts because that makes us look good. It makes our life easier as well when you provide excellent teaching. And obviously, the students provide feedback as well. So the med school actually collects surveys from the students on how they work with you, and we get resident-specific feedback in that regard. I also want to mention there is what we call multi-source assessments. So in addition from the students, the patients will assess you. So when they check out, they have a QR code. They have a very short 3-question survey on your communication skills, things like that. Obviously, they can't assess your medical knowledge per se because they don't know, if what you did was right or wrong, but they can assess your empathy and your communication skills and your professionalism. So we also collect that stuff from the other people that you work with, the nurses, the EEG techs, residents and other programs that you collaborate with. What do they think? So all this goes into your portfolio and is reviewed semi-annually. So conferences and presentations. So again, there's a stipend. I sent a link, I think, to everybody to the benefits page. That stipend is available to use for conferences. Now, again, if you're presenting a poster, you are the first author on a poster or an abstract that is at a national meeting. Then we have additional funding that we can take out of the research fund to help you attend. If you're just attending as an attendee, then the cost for travel, et cetera, would come out, and your registration would come out of your stipend. So another question about, again, year of graduation cutoff. Again, for all these things, I don't run any filters. Everything is situational. And so I do not have any cutoff for any of these metrics. I eyeball them all myself. Let's see. I think we got most of the questions. If not, you can please speak up. Oh, how long would the driving be from site to site? So my wife used to work in Wilmington, and I know from my house in Mount Laurel, it would take about an hour, but you would not be that far from where I am. So you would be a lot closer. I don't know if anyone else has made the drive, but it'd be much less than an hour from Mullica Hill. The From Vineland to Mullica Hill, I think is about 20 minutes or so. But that
Yeah,
that
it's
might be
about
just
20
the way I
minutes.
drive.
Yeah, it's about 20.
Yeah, it's about 20 minutes from Mullica Hill to Vineland. It's about 15 minutes, I believe, from like Mullica Hill to Cooper. So Mullica Hill is kind of like in a nice like central spot to get everywhere. I don't know how long it'll take from Mullica Hill to Namors though. I don't know. Maybe you could, Dr. Campbell, maybe you could talk about
I think it's
that.
about 45 minutes.
And again, we're not having anyone drive back and forth all day. So it's not like you go to Nemours in the morning and then come to clinic in the afternoon. If you're stationed at Nemours, you won't have continuity clinic during those months, and all the continuity clinics will be stacked in when you're local. That way, it'll minimize any driving. I think I got all the questions. Let's see.
Oh, you have a couple people with their hands up.
So rotations at other institutions. Only if there's an educational goal. So you will have the required rotations. General neurology is a PGY2, neuro ICU, and stroke as PGY3 at Cooper. And then you have your required rotations, 3 months of child neurology at Nemours. Any other institution would have to be set up as an elective, and there would have to be an educational goal because everything else you could imagine would be on site. Between Cooper and Inspira, we have all the subspecialties represented. Now, there's a couple of very rare exceptions, and so I can recall one resident was interested in sports neurology, and there's only like what 5 of those around the country. So something like that would be done on an as-needed basis, and again, only if there's a legitimate educational role. Someone wants to do EEG, in Miami, that wouldn't make sense because we have ample EEG available here, as an example. I see there's hands up. Olga Ochoa?
Thank you so much for the presentation. Yeah, my question is going to be, are you planning to expand the program in the near future for like a number of residents?
Well, we're still catching our breath from this. We're open to that. Obviously, when I took over Cooper, we only had 3 residents in the advanced track. And over 16 years, we expanded to 6 residents in the categorical track. Clearly, that could happen. That's not on our radar right now. We have a lot of stuff to take care of to make sure that all of you here, when you enter, that you have a great educational experience. Obviously, the volume's going to build. If we build a neuro ICU and we have the neurovascular suite, then yeah, the volume's going to build, and certainly there's opportunity for that down the road. I doubt that any of you entering as PGY1s will see an expansion during your residency program, though.
Thank you.
Salia Chowdhury?
Good afternoon, everyone. First of all, I wanted to thank Dr. Capello and Dr. Gabriel and the team for arranging this wonderful session. It was very informative and helpful for us, the candidates. I want to ask, are there opportunities for residents to get involved in neurointerventional procedures?
Oh, sure. During your stroke rotation, it's not at Cooper, it's not uncommon for residents to meet the patient on the helipad. So you're going up there and you're actually already doing your NIH stroke scale on the helipad as they're wheeling the patient out of the helicopter. And then often the residents will accompany patients into the endovascular suite. So Dr. Joven can comment on the future at Inspira, but I can tell you that we have an integrated CT and angiogram suite in the ER. So residents are commonly right alongside the patient while they're getting their CAT scan, pulled up on the imaging. Dr. Joven,
So the answer is yes. And our residents have ample exposure to thrombectomy and endovascular procedure. You can do an elective at Cooper, and as I said, as we start now doing endovascular procedures at Inspira, I don't know exactly the scope. I suspect in a couple of years it's going to be busy enough to justify an elective over there. But there's plenty of opportunities to be exposed to endovascular procedures, and some of our residents want to also be trained in that. But that's a long way from where you are. But yeah, if we have 3 interventional neurologists in our group, and myself included. So we are very friendly towards neurologists being exposed to interventional neurology.
That's wonderful. Thank you so much.
Miriam Kia?
Yes. Hello, everybody, and thank you for this great and comprehensive session. Regarding the ERAS, I just wanted to ask, do we have to, is it suggested to apply for the preliminary year internal medicine as well? Would that increase our chances for getting into the neurology afterwards, or no, we just apply to the neurology and then it's the combined?
Yeah, we're a categorical program. So if you match with us, you are guaranteed the PGY1 position. So there's no separate application to medicine required.
Okay, perfect. Thank you very much.
And then Lukman Anwar. You're muted, I believe.
Uh, Good afternoon, everyone, and thank you so much for arranging this wonderful session. I have a question. What qualities are you looking for in a incoming resident to help you to shape the future of this program?
So having been in this position before, I value residents who want to learn and be the best they can be. Uh, Obviously everyone has different talents and skills, but it has to start with the initiative of the resident striving to be the best and pull out the best potential that they have. So, obviously, personality goes a long way. This is a small program, and you're going to be working with a small number of attendings very often, as well as a small number of colleagues, other neurology residents. There's only going to be 4 of you. And so you're going to need to get along well and be flexible, open-minded. So that's the other real key that we're looking for right now. Nice people who really want to be the best that they can be.
Thank you. Thank you so much.
And I don't know, I apologize if I'm going out of order here, but Vinny Verma, I know you've had your hand up a while.
Firstly, I would like to extend my heartfelt congratulations on this new affiliation. And so my question is, what resources does the program provide to the residents for board exams? And apart from financial aid, what are the other resources provided to the residents preparing for international or national conferences?
So the stipend is available to use at whatever conference. Obviously, would have to be approved by me because it would count towards your national conference. And so, for example, the Movement Disorder Society is frequently international. The Motor Neuron Disease Society is international. Again, things that are legitimate for meeting that requirement would have to be approved by me, but the funding would be available through your stipend. And again, if you're presenting a poster, then that saves you from dipping into your stipend because we would have a different resource, available for research if you're presenting. Again, that's some more initiative for you to generate a scholarly product.
Thank you so much for answering my question and hosting this wonderful session. Thank you.
Thank you. And apologize if I'm out of order, but Abhilash Valaga.
Thank you, Dr. Campbell, for this insightful open house. So I have a question. What is the EMR you use in the PGY1 and PGY2?
So Cooper uses Epic, and then the outpatient at Deptford uses Epic. Inspira uses Andre?
Cerner.
We
Cerner.
use Cerner, but Epic is coming, from what I heard, Q1 2026. So Epic will be coming to all of Inspira soon. But Cerner right now, which I personally like, but we're getting rid of it.
Thank you.
Next, Maimuna Maheen.
Hello. First of all, thank you so much for hosting such a wonderful session. And I was particularly delighted to know how the program is affiliated with Cooper. My question is that how the program will involve innovation, which is going on in neurology, particularly in terms of artificial intelligence in the syllabus in teaching the residents.
Oh, well, we're already employing it. So for stroke codes, We use an app called Viz AI, and it gives you an idea as to the magnitude of and the probability of a large vessel obstruction. And it's available on your phone. So when the patient's getting scanned, it pops up and it gives you alerts. Your attending gets the same exact alert, and it predicts, the probability of an occlusion. And Dr. Joven can fill me in if I'm missing any updates to that. But
We have plenty of AI applications from these imaging platforms that Dr. Campolone mentioned. We're bringing in new technologies. We're in discussions with a company that detects large vessel occlusion on a plain CT and measures infarct volume on a plain CT only. From that to documentation in the outpatient setting, Cooper has is part of a pilot program that tests a program called DAX, Microsoft based, that transcribes the conversation that we have with our patients and transforms them into notes, all AI based. I'm pretty sure that we will see more and more AI-based applications. We're just introducing a cognitive evaluation method that is also AI-based for screening for cognitive impairment. There's going to be more and more AI applications, but also in parallel we are, and that's something that that's done at attending level. We are also emphasizing the human aspects of medicine, so we can still be relevant as physicians in the era of AI.
Thank you.
Thank you so much.
And
there's one question here about whether we plan on having any fellowships. So at Inspira, again, we're still catching our breath from getting online with the program. That is not something we have even thought about yet. With that said, Cooper is starting several fellowships, and so you'll have access to the faculty who are running those fellowships. Dr. Jesse Tone was just awarded a neurovascular stroke fellowship, and we are working on neuroimmunology and epilepsy fellowships. So those will, perhaps come down the road, but not at Inspira. Again, maybe 5 years down the road, we'll have more in that regard. Javiria Arshad.
Hello, everyone. Thank you so much for arranging such session. And I would like to ask, from that, we were talking about the application for the stroke patients. So do you have any wake-up stroke protocol for stroke patients?
Do we have wake-up stroke protocols?
Yes.
Oh yeah, we have very strict protocols. So well, Dr. Joven looks like he wants to chime in.
Yeah. So look, we are at the forefront of everything that is in stroke developments. Actually, I was one of the two principal investigators of the Dawn trial that basically dealt with wake-up stroke. Things have evolved in the meantime. We're not using the same strict imaging requirements. We're trying to simplify everything for stroke selection. If your question refers to whether we treat patients with wake-up stroke, absolutely we do. We are very aggressive, and we treat patients even beyond 24 hours. By the time, and we treat them based on criteria that are sort of all rooted in evidence. By the time you would be a resident, probably these criteria will have changed anyway. But yes, we do. We are very aggressive with wake-up stroke treatment, with any kind of stroke, including wake-up stroke.
Yeah, thank you so much for the answer. Thank you.
Next, I see Syed Shamir Raza has their hand up.
Yes, thank you. Congratulations in joining you from New York. Um, so my question is, what steps are you taking to foster camaraderie and teamwork, especially as a first cohort of residents, just to ensure healthy work environment?
So one thing I learned at my time at Cooper was when we were an advanced program, residents came to us as PGY2s from all over. And they were not assimilated into the culture. They were not assimilated into, they didn't know anybody. They didn't know any faces. And so one thing I wanted to get right starting this program was to make sure that the PGY 1 year was attached to this program. And so as PGY 1, you're going to have enormous support with the Department of Medicine. In fact, I think it's great because you have a lot, safety in numbers, as they say. You have great leadership. You have great structure of your rotation. Wellness is obviously a focus, as you saw on the PGY 1 year. And this is a time to assimilate into the Inspira culture, as well as learn to get to know everybody. Some of the other benefits of this is that when you are PGY2 and you're a neurology resident, you've already established that camaraderie with the medicine and psych, and maybe even surgery, all the other teams that you've already worked with during your PGY 1 year. You're now like their peer, as opposed to coming in as a PGY2 out of the blue. In that first year, you will also be with all four of the neurology residents will be in the same sort of tract, if you will. And so in the midst of the support from IM, you're going to have time to sort of develop that camaraderie amongst your own neurology, co-resident peers. And then by the time you hit PGY2, you've already had 12 months. We involve uh, PGY1 residents with all of our neurology wellness events. So if we have a journal club or we have a night out, the PGY1s who haven't even started neurology yet are invited. So you'll be part of that as well.
Thank you very much. And Dr. Campelon, will there be any in-person invites, or if that's possible, for people living in the US, if they could come and visit the area or the program and meet the faculty, like.
So at this time, we don't plan on that. I guess you understand, we just got approval, and most programs have already finished interviewing. And so we really couldn't advertise or plan very much until we had word from ACG and me. So the timing is such that, maybe for future years, we would probably do something like that. But this year, we have a very short deadline coming up.
Thank you.
So there's another question about stroke. So obviously Cooper does the interventional right now. As a resident, you will be assessing the patient in the ER. We do have telehealth with a Cooper attending who's monitoring telehealth at all times. And some patients currently may be transferred to Cooper to get intervention if they're a candidate. Now, when we have the neurovascular lab at Inspira, then obviously those patients will not be sent out. You'll be involved in them the same way a resident at Cooper would be involved, meeting the patient on the helipad or in the ER and walking them to the angio suite and being at the monitor when the CAT scan is coming up. So you will have a very prominent role in those patients. You'll be the first responder ultimately. Let's see, letter of recommendation. So again, we're not requiring a letter from a neurologist. Everything is situational. And so we look at the big picture. 3 letters is preferable. If you have some from a neurologist, that would be ideal, but it certainly does not exclude your application in any way. There's a question about QI projects. So there is internal QI projects at Inspira. there's lots of obvious potential for things. So I'll just give you an example. Some of our current Cooper residents are doing a project on health disparities regarding food deserts. So Inspira is perfect for this as well because there's lots of impoverished areas where there's not, healthy eating choices, supermarkets with fresh fruit and veggies and things like that. And so the residents are looking at stroke patients and giving them education on how to eat wisely, how to find healthy food in the midst of convenience stores, and then doing follow up on them to see if their stroke risk has gone down after that education. And obviously, this is something that would be easy to apply at Inspira because you would have the same sort of patient audience, patients who may have limited access to healthy eating choices. Or may have poor knowledge of healthy eating choices. So again, there's lots of opportunity. I failed to mention that Dr. Hanafi is the director of research at the CNI, and he has a monthly meeting, a multidiscipline meeting for research and QI. So, and that is on your didactic schedule. So that monthly meeting, you will participate again with the CNI as a whole for both research and QI projects. And so you will present. You have a QI project or you have an idea, then you present. Dr. Hanafi oversees that. The other residents will be there, other participants. So we do have some collaboration in QI with perhaps like radiology and medicine and so forth. So I think there's certainly a lot of material available. They'll make it quite easy for you to have a meaningful QI project. I think I got to everything, but if there's anything I missed in the chat, please speak up. Otherwise, I want to thank all of you for stopping by today. I know this was short notice. As you can see, we had a great turnout, and I want to thank all of you for coming by to get this information. I want you to have all of the information that, I see there's a hand up. I want you to have all the information that you need to make the decision, because the decision is not just on our end. The decision also lies in your hands whether we're a good fit for you. And I want you to have the honest answer for these things, because there's no sense in me misrepresenting anything and then you coming here and being unhappy. So I like to lay everything on the table as I can. So please feel free to reach out down the road should you have any other questions. Now I do see Kiran Kamari has a question.
Yes, good afternoon, team. Thank you for arranging this open house session, and it was a really appreciate your time. I have a quick question. Like it is the annual research day held on at the Cooper and.
So Inspira has its own resident research day, and where are we at here? So Cooper also has a separate research day. So the situation would depend on where your research took place. Obviously, you could present at both. Like I said, a lot of the medical students have a requirement to do some research, so our residents find them useful in doing a lot of the busy work, and you do the intellectual contribution, and you can get credit. So you could present a poster at the Cooper and at the Inspira Residency Day. I do not know the actual date they're holding it this year, but the Cooper poster it's actually a contest, is held usually during match week.
Thank you so much.
And I think I answered all the questions. So if not, please, again, feel free to reach out by email. I want to thank Dr. Joven, Dr. Drea, and of course, Amy Land for all of the support making this residency happen, as well as for filling in a lot of the information today. And I want to wish all of you good luck on any of your remaining interviews. As I mentioned, our invites should go out starting later today and tomorrow, and hope to see you down the road in some context. So enjoy your day, and thanks for attending.
Thank you.
Thank you
Bye-bye.
so much.
Thank you
So
very
much.
much.
Thank
Thank
you.
you.
Thank you so much.
Have a
Thank
great
you
day.
so much.